You know, a single decision a doctor makes can literally change a person's life in a heartbeat. It's an immense amount of pressure. But what if they had a co-pilot, a sort of second brain to help them cut through all the complexity of modern medicine? Well, that's exactly what we're diving into today. How AI is becoming this incredibly powerful assistant right there in the doctor's office.
I mean, that's really the big question, isn't it? How do we help doctors make that perfect call every single time? Think about it. They are just swimming in data. Patient histories, lab results, new medical studies coming out every day. It is a tidal wave of information to process for just one diagnosis. So the real challenge is, how can we possibly build a system that helps them make the absolute best call every single time?
And let's be real, this is one of the toughest challenges out there. Making just one diagnosis is a huge mental lift. A doctor has to connect the dots between symptoms, lab results, family history, even a patient's daily habits. And on top of all that, they have to keep up with medical guidelines that are constantly changing. It's just an unbelievable amount of information to juggle all at once.
So to tackle that challenge, a really powerful solution is starting to take shape, and it's this idea of a second brain for doctors. It's basically an intelligent co-pilot, and the goal here isn't to replace their judgment, not at all. It's to enhance it, to give them a tool to help make sense of all that mind-boggling complexity.
Okay, so this second brain actually has an official name. It's called a Clinical Decision Support System, or CDSS for short. So what is it, really? Well, at its core, it's a piece of software that takes a patient's data, runs it against this huge library of medical knowledge, and then gives the doctor smart recommendations that are backed by science, right when they need them most.
And that phrase right there, intelligent support, that's everything. That is the whole point. Let's be super clear. These systems are not being designed to take a doctor's job. Nope, they're built to be the smart, relevant backup, the expert wingman, if you will, for the human who is and always will be making the final call.
Okay, so here's where it gets interesting. Not all of these digital co-pilots are the same, not by a long shot. They basically fall into two main camps, and the way they think is completely different.
So, on one side, you've got your rule-based systems. These are kind of the old-school approach. Think of them like a super detailed flowchart. They follow these really strict if this, then that commands. If the patient's blood pressure is over this number and they have diabetes, then recommend this specific medication. It's super reliable, but it's also very rigid. But then, you have the AI and machine learning-based systems. Now, these are a different beast entirely. They don't just follow pre-programmed rules. Instead, they learn from millions upon millions of past patient records to find subtle patterns that a human might miss. They're not just following a script, they're actually adapting and getting smarter the more data they see.
All right, so that's the theory behind it all. Rules versus smart reasoning. But what does this actually look like in the real world? Like in a busy hospital or a clinic? How does a doctor actually use one of these things day to day? Well, to make this super clear, let's just walk through a hypothetical case. Let's imagine a patient, a 52-year-old man, who comes into his doctor's office. He's not feeling great, and he's got some symptoms that are pretty worrying.
So here's how a visit like that might go with a CDSS. First, the doctor inputs all the key data into the system. Our patient is 52, he's got chest pain when he exerts himself, and he's a smoker with diabetes. Okay, that's step one. Step two, the system goes to work. Instantly, it crunches all that information, compares it against its massive database, and spits out a list of possible diagnoses, usually ranked by how likely they are. But now we get to the most important part. Step 3, the decision. The doctor looks at those suggestions, but they don't just blindly accept them. They use their own training, their own expertise, their own intuition to make the final call and create a treatment plan. See, the tool offers suggestions, but the doctor is the one making the decision.
And this is where you really see how versatile these systems can be. This isn't just a tool for one specific scenario. In a chaotic emergency room, it helps with quick, life-saving triage. For a patient with long-term chronic conditions like diabetes and high blood pressure, it helps manage all those moving parts. When prescribing medicine, it's a lifesaver, flagging potentially dangerous drug interactions. And think about rural clinics, where a doctor might not have a specialist down the hall. This system can be an absolute lifeline, offering critical guidance.
So, what are the benefits of having this digital co-pilot? Well, they're pretty huge. We're seeing a real reduction in diagnostic errors. It also helps make sure that the treatments being prescribed are actually in line with the latest best practice guidelines. So it really raises the standard of care across the board. And maybe most importantly, it acts as a vital safety net for newer doctors or for any clinician who's just completely swamped in an understaffed hospital.
But, and this is a really, really big but, this technology is not a magic bullet. Not at all. It's an incredibly powerful tool, for sure. But just like any powerful tool, it has its own challenges, and it absolutely requires a skilled human expert to use it right. The human has to always be in the loop.
Yeah, there are some pretty serious hurdles we have to think about. For one, there's something called alert fatigue. If the system is constantly pinging doctors with notifications, they might just start ignoring them all. Then there's the risk of over-reliance, a doctor just blindly trusting what the computer says without using their own brain. And this is a huge one. The system is only ever as good as the data you feed it. The old saying, garbage in, garbage out, is truer here than ever. And all of this leads to some massive ethical and legal questions, right? If an AI is involved and a mistake is made, who's on the hook? The doctor? The hospital? The people who wrote the code?
At the end of the day, it all comes back to this one key idea. This is about smarter support, not replacement. The whole point of this technology is to augment the amazing expertise of a human doctor, to be that second brain that can double-check things, offer a different perspective, but to never replace their judgment, their empathy, or their years of hard-won experience.
And all of this leads us to a really fascinating and kind of tricky question for the future. As these AI systems get even smarter and easier to access, should you and I, the patients, be able to use them directly? I mean, what would it look like to get a diagnosis from an AI doctor right from your couch? That's something we're all going to have to grapple with as this technology keeps changing the face of medicine.